Okay, and our first test, it's going to be straight leg raise up. Why are we checking the straight leg raise up? Why are we doing this test? We want to see how this hip flexors is active and also see mobility of the hip. And also, if any pain present, it's going to be the disc problem. I will show you right on the spine. So if I am... You're going to be okay if I push it right here, pull it right here? Okay, perfect. So think about it. This is the leg, and it start tilted this ilium down, and look what's happening. If this is, it start open this up, and this is the cause the pain. That's mean this disc is being jammed, and one of the disc push on disc, usually it's L3. So really careful. Sometimes people come to this stretching class, and of course, this is the favorite stretch of the leg raise extension. Guess what? You feel some discomfort, you feel pain, and most of the time, it's like, are you gonna be all right, man? You're gonna be okay. It's perfect. Yeah, just through the pain, it's gonna be perfect. No, it's not, because your disc is jammed and it's caused pain. It's not good at all. So make sure it's not painful. It can be restricted, but non-painful. This is the big difference. And of course, we're gonna check this passively. So what we're looking for 70 degrees. During this test, you wanna make sure it's no compensation from other side. The other leg is stay where they are. And it's slowly, without bending the knee, he's gonna reach this 70 degrees. So let's prepare that test. And I'm gonna ask David to slowly start raise your right leg up. What I'm looking for here we go. And that's probably right there, because you see he start lifting this heel up and he's bending up here. So this is probably right in here, and this is not 70. This is okay, it's not 70. Let's see if I can help him out. I usually standing right on the side I treated, but for the camera purpose, I'm standing this way. Don't do that, because you're gonna injure your shoulder. What I'm doing here, I'm a little bit place my hand on this hip. Just make sure it's not gonna lift it up, so I compensate. And I see if I can bring it more. And remember, the passively have to be 80 degrees. And guess what? It's go really nicely, but yeah, it's still a little bit short. So let's say this is mobility problem. It's not a stability problem, but it's really close actually. But I feel restrictions. Never push with the force. If you still feel 5 pounds restrictions, stay there. That's the limit of the motion, okay? So, and now we're gonna test, of course, the left leg. Keep this neutral, go ahead, lift it up slowly. And it's probably about that. Do you experience any pain?
No.
Okay, and of course you can see he's limited to, it's probably like 45, 50. Yeah, 45. And I'm trying to do here, no, it's restricted too. So we have both mobility, hip mobility problems, and of course something going on with hip flexors. So this was the straight leg test. So our next test is going to be adduction, hip flexion, and external rotation of the hip. So this is called the Faber test. What we're doing here, we're going to bring this knee and place right above the knee on your opposite leg and try to drop this knee down. Let's see how they gotta go, okay? And you see the space, it have to be 2 fists of measurement, and make sure it's not compensation on this side. So I'm gonna bring the camera and I'm just introduce you this, show it to you. So yeah, make sure it's not, and you see this coming more up. So now I'm gonna show you the measurement. And the measurement is you place your 2 fists right in here. And you can see it's a lot of space, even more in the my fist, not the David fist, and it's still space. So we have a limitation up here. And sometimes people measure up here, a little bit lower, or in here. No, you have to measure right below the knee. Where's that patella bone? Okay? So make sure you're doing right measurement. Okay, and I'm going to measure to other leg. Let's see if any pain present. And of course you do passively too. As you can see, I'm going to bring the camera on this side. I come up here even more. try to do passively, I lock this hip in and try to push down, and it's not going anywhere. So that's mean it's mobility problem. It's not a motor control problem. We have to treat this mobility first.